us to distribute the vaccine in the most equitable and fair and free way. By that president, I mean one who will take office 1 month from now, Joe Biden. I do want to speak to the bill that will be on the floor shortly. It is a good bipartisan bill. It does, as different from bills that have been proposed on the Senate side by the Republican leader, it does things that his bill never did, and that is it addresses the food needs of the American people. Maybe 15 million children are food insecure in our country, and adults as well. Millions of families on the verge of eviction, and this legislation addresses the rental needs and a short-term moratorium. We can accept the short-term because we'll have a new president during the length of that moratorium to extend it further if necessary. We also have in the legislation direct payments, which were not in the Republican bill, to America's working families. I would like them been bigger, but they are significant, and they will be going out soon. The president may insist on having his name on the check, but make no mistake, those checks are from the American people. The American people's name should be on that check, no individual, because that is the source of the resources for those checks. Tax-paying Americans. In addition to that, the list goes on of some of the very positive things that are on the bill. And quite frankly, some of them did not come to agreement until yesterday. Whether we're talking about WRDA, the Water Resources Development Act, a big jobs bill, had bipartisan support, but some disagreement over language. And by the time that was resolved, it pushed the bill from coming to the floor later. We didn't have, in the start of the day, sick leave. That is in the bill, almost $2 billion for sick leave. It didn't have the EITC, the Earned Income Tax Credit, for working poor people to have that boost, as well as the child tax credit. It did not have the employment retention tax credit. Bipartisan support on WRDA and on that, and then we came to agreement not only on the language, but where that initiative will be placed in the ballot. So many of these things need to be precisely written and assembled in order for a bill to come to the floor, which we anticipate will be pretty soon this morning. One of the things, though, that is disappointing, because for a long time now, our House Democrats and Senate have been saying we want to crush the virus, put money in the pockets of the American people, and for the title of our bill before, honor our heroes, our state and local workers who are on the front line. When we talk about those on the front line, our heroes, necessary in meeting and crushing this virus, we're talking about healthcare workers in cities, counties, and states. We're talking about first responders, police and fire, someone first on the scene to help someone with the coronavirus. We're talking about our teachers, the custodians of our children for a large part of the day. We're talking about our transportation, sanitation, food workers, those who make our lives possible. I think it'd be interesting to point out that as enthusiastic as we are about the PPP provisions in this bill, and we all support them in a bipartisan way, it's important to note that small businesses, I always say there's nothing more optimistic than starting a small business, maybe getting married. But the optimism, the hope, the dream that people have, it was completely, shall we say, darkened by this assault of this virus. And that's why we had to start by crushing the virus. We didn't do it. We couldn't pass legislation until now because the administration simply did not believe in testing, tracing, treatment, wearing masks, sanitation, separation, and the rest, scientific approach. It had come clear to us now that they believed in herd immunity, quackery, springing right from the Oval Office, and not denied sufficiently by some of the CDC and the rest. So now we have a vaccine, and that gives us hope. A vaccine that springs from science. People say around here sometimes, I'm faith-oriented, so I don't believe in science. And I said, well, you can do both. Science is an answer to our prayers. And our prayers have been answered with a vaccine. And in this legislation, we had provision for it to be developed, purchased, and distributed in a way, again, that is fair and equitable and free. What we couldn't get ever, even with the previous legislation just on testing, et cetera, was this adequate language to recognize that this coronavirus has taken a horrible toll on our whole country, more so among people of color. More people have died from the coronavirus, people of color. If you were a child who was Hispanic, you had an 8 times more chance of going to the hospital because of the coronavirus than a white child. If you're African American, you had 5 times chance more of going to the hospital because of the coronavirus. So now we have a vaccine that we hope will reach everyone as soon as possible. What I'm heartbroken about this bill, though, is while we make an attempt to crush the virus, we don't do it adequately enough in terms of recognizing the toll on people of color, but we will have to do that in the public sentiment of it and the demands that we make on governors and others who are in charge of the distribution. But we put money in the pockets of the American people. We want to do more, but nonetheless, we are meeting the deadline, December 26th, on unemployment insurance, which was vital. But the third thing, honoring our heroes. As I said earlier, our healthcare workers, our first responders, police and fire, sanitation, transportation, food workers, teachers. We just decided that while they're on the front line, while they are risking their lives to save lives, many of the healthcare workers and police and fire, et cetera, they're about to, many of them, to lose their jobs. Many of them have already lost their lives, and many have lost their jobs. So why is it that this Congress and this White House refuses to recognize the value, contribution, the sacrifice of our again, heroes, our people on the front line? It's interesting, I think, to note that when we passed a number of bills in a bipartisan way, and we'll pass this one today. In the course of that, with the CARES Act and the follow-up on the PPP bill and this bill now, we are approaching $1 trillion that we are putting out for PPP. If that is what is needed and is spent effectively, that's a worthy expenditure, but almost $1 trillion. Well over 750,000. This bill alone over $300 billion. So we have PPP. Now, in order for the private sector to function, in order for us to live our lives, we need to have the public sector, public transportation, public schools, public health. The list goes on. So it's not about public, private, it's about people. People who are doing the jobs. Again, risking their lives to save lives. They lose their life and maybe lose their job. Many have lost their lives. Many more have, of course, lost their jobs. So we have nearly approaching $1 trillion for the PPP, small business, which I support all the way, and $150 or $160 billion for state and local government, which enables the private sector to function, which enables us to crush the virus, which enables us to meet the needs of people. 150-60 versus well over $800 billion already. How could that be right? Except the Republicans insist on saying, we don't want to give money to blue states where the coronavirus is. It's in red states too. It knows no borders and it knows no party, this vicious virus. But somehow or other, the Republicans have said to our heroes, our healthcare workers, our teachers, our transportation, our police and fire and the rest, sanitation workers, so important, food, you are not worthy of support because perhaps you're in a blue state predominantly, and therefore we undervalue your contribution to our society, to our economy, and especially now as we try to minister to the needs of people in this coronavirus crisis. Who do you think these vaccines come into a state? They go from the lab to your arm magically? No. They have to be received, distributed, administered, and done so fairly, equitably, and free. Who do you think is going to do those jobs if you don't respect the role of state and local government in all of this? But don't think of it as government, think of it as people. Think of it as yourself needing all of that. So I would hope that as we see the need for what we have done in this nearly $900 billion legislation that we'll vote on today, that everyone understands it's a first step. It's a first step, as President-elect Biden has said. It's a first step. And we will need to do more to get more virus assistance to crush the virus, but also more money to buy more vaccines. We need to have the Defense Production Act in play to hasten the manufacture of these vaccines. And we need to be able, as I say, to get the job done, and that takes people. And people need to be respected. Their work needs to be valued, and their entities for whom under whose auspices they work, public hospitals, all the rest, and education, so important. And yet, many of our teachers have lost their jobs. We need more teachers because we need more space to separate, to again protect our children. We always said, if you want the economy to open up and you want our schools to open up, you must crush the virus, or at least take the precautions so that people are not in jeopardy if they go to work or when they go to school. Schools should be the safest places in America. Should be the safest places in America for our children, and they can be if science is respected and if the mask wearing, distancing, and the rest. But you need more space, you need better ventilation, as Bobby Scott tells us over and over, and you need more teachers. So this is a big mistake. The Republicans said, oh, you can get a small amount, not even approaching in any way the PPP. And again, no resentment there. We support that. But the recognition that that is important should also recognize that the sector of our economy that supports the private sector be recognized. And so on that score, you come to a situation where how could it be that we only have $160 billion for state and local, where we have nearly approaching $1 trillion for PPP, not recognizing that the private sector is connected to the public sector. Now, one more point on that. They said you can have some money for state and local. We'll decide how it will be distributed if you do surrender the rights of workers. In other words, just in case anybody doesn't know, there are essential workers who are required to go to work. If they don't, because they're concerned about danger to their health and the health of their families, because the workplace is not safe, they cannot go on unemployment insurance. And if they go to work and contract the virus, they have no recourse, because that's the way the Republicans want it. That's the way the Republicans want it. It's so anti-worker. And just for good measure, they have thrown in certain aspects of the Civil Rights Act, the Americans with Disabilities Act, the Fair Labor Standards Act, OSHA. The list goes on in Section 42 of their heinous liability bill of all of the actions that cannot be taken. I want to ask one of the Republican senators, what is the ADA, preventing the ADA to honor its Americans with Disabilities Act, to honor its responsibility? They said, why don't I have the Chamber of Commerce call you and tell you? I said, why don't you not waste my time or the Chamber's time about why the ADA should not be enforced because of the virus. This is coronavirus-centric. We said that we could find a compromise on liability for the time of the virus and in a way that is fair to those employers who want to protect their workers and to the workers. They decided they would turn it into some massive, long-term, ever-encompassing liability. Just so wrong to workers. That's not what our system is about. But nonetheless, still thought we could try to find a compromise. We couldn't. They were absolute. Just call the Chamber of Commerce. They'll tell you why they can't meet the needs of their workers. But getting back to the money, nearly $1 trillion PPP, 160, and not even giving the states and localities the flexibility to use the funds for both addressing the COVID needs, the health needs, but also the revenue lost. Even the Republican governors wanted that flexibility, but they wouldn't give it to us then, and they wouldn't give it to us now, for fear that some blue state governor might, or city or mayor, county executive might take advantage of that. We've never done enough for localities. That's the pitch we had made. That's what we had in the HEROES Act, but there was no market for that on the Republican side of the aisle. So when we say it's a first step, let us embrace it. Let us thank God Chuck Schumer was able to dismantle, in part, the Tumi Resolution that would tie the hands of a president to meet the needs of the American people and our economy by exercising Section 13(3) of the National Reserve Federal Reserve Board. So we got past that, which took a long time. I thought Wednesday night we were finished. This monstrosity reared its head the next morning. Chuck effectively was able to fix it. It still should not have even been initiated. But nonetheless, fix it in a way, Leader Schumer, in a way that enabled us to go forward. And that's why it's taken this long to get here in these last few days. So, again, I look forward to Anita Lowy bringing the legislation to the floor. As the chair of the Appropriations Committee, this will be her last bill on the floor. In fact, it's the last bill for many of us here, but hers as chair of the Appropriations Committee. She and her staff, Shalonda and Chris and so many others, and all of our chairs did such a remarkable job, and their staffs deserve so much credit for all of this. And again, we will do some good with this